Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
What is the actual list of liver transplantation? So, in the indications of liver transplantation, first in the children, the indications of liver transplantation are we have a lot. We have biliary atresia, neonatal hepatitis, congenital hepatic fibrosis, Alagille syndrome, Bayer's disease, alpha 1 antitrypsin deficiency. Then we also have diseases like inborn errors of metabolism in children, like Wilson's disease, tyrosinemia, glycogen storage disorders, lysosomal storage disorders, protoporphyria, Crigler-Najjar syndrome disease type 1, familial hypercholesterolemia, primary hyperoxaluria type 1, and hemophilia. All these are inborn errors of disorders of metabolism, then which require liver transplantation. So these are the diseases which require liver transplantation in children. Now, indications of liver transplantation in adults. So in adults we have diseases like primary biliary cirrhosis. So we have diseases like primary biliary cirrhosis, secondary biliary cirrhosis, primary sclerosing cholangitis, autoimmune hepatitis, Caroli's disease, and cryptogenic cirrhosis are associated with liver transplantation. Similarly, the other diseases are we have chronic hepatitis with cirrhosis, hepatic vein thrombosis, fulminant hepatitis, alcoholic cirrhosis, chronic viral hepatitis, primary hepatocellular malignancies, hepatic adenomas, non-alcoholic steatohepatitis, and familial amyloid polyneuropathies. All these are also associated with liver transplantation.
thank you and thank you for watching.